Men of African American descent are at a significantly higher risk of developing prostate cancer than white men. Among black men, 19%, nearly 1 in 5, will be diagnosed with prostate cancer, and 5% of those will die from this disease. I'm Max Gulias, and we discuss the importance of prostate cancer screenings in this episode of The Professors.
From across the city and the 7 city colleges of Chicago, broadcasting from 63rd and Halsted at Kennedy King College. Professors take the art of conversation to a higher degree.
The American Cancer Society recommends that men make an informed decision with their doctor about whether to be tested for prostate cancer. The American Cancer Society believes that men should not be tested without learning about the risks and possible benefits of testing and treatment. Our guests are Mary Maryland, President of the Illinois Division of the American Cancer Society, Tracey Johnson, a cancer survivor, and Joe Harrington, Assistant Commissioner of the Chicago Department of Public Health. Welcome, all of you. Thank you so much for being with us today for this very, very important issue. I wanted to begin with Mary Maryland. With regard to the incidence of prostate cancer, the kinds of risks that are in play. Why is it that African American men are at such a higher risk for acquiring prostate cancer?
According to the American Cancer Society, we don't exactly know why there is both an increased incidence and increased mortality or death rate from prostate cancer for African American men. Mm-hmm. But what we do know, and according to the newest guidelines released earlier this month, is that there is now best science that indicates routine screening may not be as helpful. Mm-hmm. And so the guidelines recommend that men in general talk with their healthcare provider about whether or not they should have the screening at all.
And when should that begin? When should that process, age group, at what level should that discussion start?
For men at average risk, that discussion should include information by age 50, so that a person could make the decision with their healthcare provider if screening was the appropriate thing for them to do. More importantly, though, if a man is at greater than average risk, an African American with a family history, a father or brother who has had prostate cancer, the recommendation is that that screening should start as soon as age 40.
Mm-hmm. And that's a big drop-off in age. We're talking about 10-year difference. And it's that kind of family history that many men should definitely be aware of. The kind of family history that is strikingly unusual and requires so much heroic courage and heroism to survive, of course, is something that all cancer survivors have to go through. We have a very, very unique individual with us today, Tracey Johnson, again, cancer survivor. Congratulations.
Thank you, sir.
And I wanted to ask you, though, Tracey, about your own experience. I mean, we've just heard from Mary Maryland about the age when men, and African American men especially, should begin talking about prostate cancer screening. Your experience, however, is a little bit different from that, dramatically so. When were you diagnosed with prostate cancer?
The age of 22.
22 years old.
Yes.
And you have been surviving cancer now for how long?
I'm 46 years of age, so I let somebody else do the math.
But that's quite a story, just by itself. The fact that you got it so young, and you've been fighting it successfully for so long. Could you tell us now about what did you feel when you were diagnosed with prostate cancer at such a young age? And we're also talking about a time period when information about public health was not nearly as prevalent. It must have come as quite a shock.
It was very much of a shock. I was in my youth. I was a football player at the University District of Columbia in Washington, D.C., and I had symptoms of inflammation of the prostate, and it was something that I had treated for like 8 months, but everything kept reoccurring. So the team physician suggested I see a urologist. Mm-hmm. And you're at the age of 22. The word urologist really intimidates you. And so I followed
And
up
an
with-
athlete as well.
Yeah, because
So
you know,
it's like,
a man's worst enemy is his pride.
yeah, absolutely.
You know,
Yeah. What was your position, by the way?
I was a wide receiver.
Oh,
So
you're faster than everybody else, right?
There
It's
you
like
have
there's
it.
no other chance that you're even going to get caught, right?
okay. And so you're a young man, vibrant.
Yeah.
Nothing can happen to you.
Yeah,
You're
yeah,
invincible. And then all of a sudden the team physician starts throwing words at you that you haven't heard. Urologist. And I was like, why do I need to see a urologist? And it was scary, very intimidating. And so, but I was blessed that my uncle, when I was in high school, he had inflammation of the prostate as well. But at least he took the liberty to explain to me what his process he was going through at the hospital, and allowed me to be in the room with him when he spoke with the doctors and to see what was going on. So when I did go to the doctor, he explained what the test results were, and we did the DRE exam along with some other blood work, and later they followed up at Howard University Hospital with surgery. And at that time, they did not put you under. You were wide awake through the whole procedure.
Wow.
And it was very, very intimidating because I didn't tell any of my family back here in Illinois what was going on. Again, man's worst enemy is your pride. So I don't want to tell my grandmother anything because a lot of things she expressed to me as a young man were coming forth.
You're a kid yourself at this point, and this is all speeding ahead so
Yes.
quickly, right?
So,
you're probably just in a daze, right?
In a daze, wondering who do you talk to,
Right.
who is a mentor that you can speak to in reference to what you're going through. And so we went through the process, and while they were checking my prostate, they recognized an abnormal growth. And I told the doctor, this is a very painful process. Whatever you got to do, take care of it while you're in there now.
Yeah.
And he took care of it, and he laughed because I was the youngest patient they ever had.
Wow.
And that scared me because I thought this would be the norm of someone else.
Sure.
But they said I was the youngest in Howard University's hospital, history. And there I was just scared because where's the support group?
Yeah, especially at that age, right? Again, but of course, gender as well, and also in relation to African American men. Joe Harrington, when it comes to the sorts of experiences we just heard, some of this obviously can't be replicated across. We can't pre-screen for African American men at such a young age. But certainly, this kind of experience shows what's unique about this challenge, this public health challenge. Could you speak to that as a public health official?
I think I can, and I think Tracey actually opened the door to talk about a lot of things that we need to explore a little bit further. One, we talked about earlier the fact that African American men are 66% more likely to develop prostate cancer and twice as likely to die from it. His experience is unique because it happened at an early age, but there are a lot of lessons that I think the viewing audience can pick up from his experience. One is very important, and the major change in the guidelines from the American Cancer Society talk about this issue of informed decision making, and he made an informed decision with a physician, and that's what it's talking about. You need to gather the facts, you need to have information, and make the best decision, and the decision that's right for you. So he made a decision, he had the information, and he made a decision that was right for him. The other thing, in terms of this issue of age, prostate cancer is much more likely in older men. And in fact, I think it's somewhere around 75% of all prostate cancer occurs and is diagnosed in men over the age of 65.
Could you speak why is that the case? I mean,
I think it really has something to do with just aging. One of the things, and they've done autopsies of men in their late 80s and 90s, and many of them die with prostate cancer. Prostate cancer is a very slow-growing cancer, and older men, much older men, generally outlive the cancer, and that's why there's generally a recommendation that if you don't have more than 10 years of life expectancy, there's no need to be screened, there's no need to do much of anything, because you're much more likely to die from something else. And I think it's important to point out as well, more men, and most men do survive prostate cancer. I mean, we do see a significant number of men that do die. I don't want to diminish that in any way, but most of the men that get prostate cancer do in fact survive it. That's because it's detected early and it's treated. So it is something that can be treated, and as Tracey can point out, it's something that men can leave a very productive and enjoyable life with moving forward.
And being very, absolutely.